Hey YouTube, hey Broken Bougie Squad, welcome back to another video. In today's video, guess what we're going to talk about? I'll wait. You're never going to guess what we're going to talk about. So today we are going to talk about bariatric surgery, weight loss surgery, the gastric sleeve, the vertical sleeve of VSG. So if you are interested in weight loss surgery, bariatric surgery, planning to get bariatric surgery or weight loss surgery, have questions, want to see somebody who already got it done, just curious or just nosy, stay tuned to this video. Okay. All right, guys, I'm back. Like I said, as you can see in the title below, this video is about weight loss surgery, bariatric surgery, preferably the vertical sleeve gastrectomy.
That
or VSG for short, or the gastric sleeve. So, is no secret. I had weight loss surgery 7 years ago. My highest weight was 240, and I went all the way down. My lowest weight was 149. So I had surgery around 2014, 2015, whatever 7 years ago was. Okay. So, yeah, so I had bariatric surgery about 7 years ago. I started struggling with weight when I hit 25 years old. Like, sis, when I hit 25 years old, like, shit hit the fan. I don't know what the hell happened at 25 years old, but shit hit the fan. Like, I've been small my entire life. I've been 110 to 130 pounds all my life. Okay? And as soon as I hit 25 years old, shit hit the fan. Like, I don't know what happened. Like, girl. So yeah, 7 years ago, I got the gastric sleeve, and I'm gonna tell you all the deets about that. So before I get into it, like I said, I don't know what happened when I hit 25 years old. Shit hit the fan. I gained all this weight. I know I had some poor eating habits, but it wasn't nothing out of the norm of what I've been doing all my life. I was more active back then. I was athletic. I was an ROTC. I was a dancer, not a stripper, but I'm 2 paychecks away. Okay. But shaking that ass. Okay. But anywho, but yeah, like, I don't know what the hell happened. It was like one of my exes was put a damn root on me or something. They was like, bitch. Girl, it was like one of my exes put a root on me, and it was like, Najee rumba, let this bitch get fat. Najee rumba, let her ass get hungry. She got a slick ass mouth and she get on my nerves. Lord. And it worked, because my ass got fat. Okay. Shit. But yes, girl. So let's talk about the different types of bariatric surgery first, okay? So the different types of bariatric surgery is, let me take this thing off my head. So the different types of bariatric surgery is, of course, the VSG, vertical sleeve gastrectomy, which is the gastric sleeve. And then they have the gastric bypass. And then they also have the lap band. And lastly, they have the revisional bariatric surgery. And speaking of the lap band, I don't think surgeons even do the lap band anymore. I don't even think that's a thing anymore. So we're going to talk about the gastric bypass, VSG, and revisional bariatric surgery. I'm looking now because I'm looking at my notes. And so, speaking of VSG, which is what I got 7 years ago, like I said, my highest weight was 240. Mind you, I was 130 pounds, and I shot up to 240 as soon as I hit 25 years old. Like, I need an explanation for that other than I was eating Debbie cakes. Like, it got to be more than that, okay? But anywho, so yeah, so my highest weight was 240. I got the vertical sleeve gastrectomy. Surgery time usually takes up to 3 hours. And guess what? So, surgery takes up to 3 hours, and they do the surgery laparoscopically. So you're not going to have some big old scar, some ugly scar. It's only like 4 to 5 incisions, like little like paper cut incisions, and you won't even notice on nobody that they even got surgery. They do the surgery laparoscopically, and they remove part of your stomach out of that that area, okay? And you're not gonna have a big scar. You're not, unless you one of those people that keloid or anything like that. But if you're just have normal skin, normal person, sis, nobody even gonna notice that you even had surgery. So the purpose of bariatric surgery or weight loss surgery. First of all, I want to emphasize and stress enough. This is not cosmetic surgery. This is not a BBL. You're getting your boobs done. You get a tummy tuck. No, sis. This is not cosmetic surgery. You have to be approved by many doctors and your insurance. Ooh, my lip gloss. And your insurance to get this surgery. You have to qualify to get this surgery. So when I got it done 7 years ago, I got mine done in Georgia. I had Blue Cross Blue Shield, and depending on your insurance, that's how long the process is. So when I first got it done in Georgia, I had Blue Cross Blue Shield, and because I had 0 medical issues, my ass was just fat and like to eat.
People, tell me about the rocks. Leave me alone!
They approved me within 3 months. I had to go through many doctors, which I'm gonna get into, before my insurance approved me, and it took 3 months because I followed the process. I got everything done that I needed to get done, and I got my surgery done within 3 months. Mind you, and it's also because I had 0 medical issues. So they go by your height, your weight, and your BMI, okay? And also if you have medical issues to get approved for weight loss surgery. Once again, this is not cosmetic surgery. This is for people who are obviously obese, morbid obese, have medical issues due to obesity, and that's why, okay? Okay, so let's get into it. What is a VSG? What is the vertical sleeve? What is the vertical sleeve bariatric weight loss program, okay? So VSG is a minimally invasive procedure during which the size of your stomach is reduced to 3 or 4 ounces. So listen again. The size of your stomach is reduced to 3 to 4 ounces. So basically, they are going to look at your stomach. They are going to do a procedure where your stomach is reduced by 80% on the vertical sleeve. So you will be left with your stomach the size of a small banana. That's why it's called a sleeve. It's like the shape of a sleeve. So your stomach will be the size of a small banana. So this will then limit the amount of food you can eat to help you lose weight. So it's not going to prevent you from regaining weight. It's not going to prevent you from eating. It's just a tool to help you lose weight. And it's a minimally invasive way to lose weight and the most effective way to lose weight other than diet and exercise. But diet and exercise don't always work for everybody in a timely manner, okay? Especially if you have medical issues. So, after a VSG, levels of Ghrelin, I don't even think I'm pronouncing right, but it's spelled Ghrelin, which is a hunger hormone, also drops. So your appetite is initially reduced. So the hunger hormone called Ghrelin, okay, it's called Ghrelin, Ghrelin. So we're going to speak about that. What is Ghrelin? Of course, I'm not pronouncing that right. Look it up. Google it. But it is a gut hormone. It is a gut hormone that causes you to eat. So it functions as a stimulatory effect on food intake, fat deposition, and growth hormone release. So basically, it's a growth hormone, it's a hunger hormone. So when you get bariatric surgery, the surgery cuts off that growth hormone. It could grow back if you don't follow the plan. However, essentially, it cuts off that growth hormone, that appetite hormone that causes you to eat. In normal people, in the majority of people, that growth hormone that you have in you, in your gut, will let you know when you're full, when to stop eating, etc., etc. However, in some people who are usually overweight or obese, that growth hormone no longer works. So when it no longer works, it tells your brain to continue to eat. Like the people on that show, My 600 Pounds with Dr. Now. I'm sure you watch that show. And you'll be sitting there wondering, like, how you just keep eating and eating? Because that growth hormone is broken. It's not just obviously just the growth hormone that's broken. There's other factors as well. But essentially, that growth hormone is broken. It's not working right. So, let's see. So, after that, patients who choose VSG can expect to lose up to 60% of their excess body weight. So, when you remove 80% of your stomach, remember, it's going to be like a small banana now. Small banana. You're not going to be able to intake much, right? So, the whole point of bariatric surgery is for you to lose weight. So, if you look on that show, My 600 Pound Life, or anybody that you know that had bariatric surgery, you've seen that they typically drop the weight drastically, right? Because number one, they cannot eat much. Number two, they probably develop a food aversion. They get probably getting sick, having dumping syndrome, or eating over the recommended amount that you're supposed to eat, which is probably like 2 to 3 ounces at a time, and getting sick like that. So for me, it took me 6 months to lose all my weight. Like I said, I went down to 149, and in 6 months, I lost all that weight. Really. It's crazy. But then by 6 months, the majority of the weight was gone. And then by 8 months, I was literally at 149, period. And I kept that off for up until 3 years ago. All right, so this type of weight loss surgery is associated with minimal post-operative pain. Like I said, it comes with 4 to 5 laparoscopic incisions, okay? So very little, it looks like a paper cut. You wouldn't even know you had surgery. So like I said, it says this weight loss surgery is associated with minimal post-operative pain. So everybody is different, but it is meant for you to have the minimal pain, okay? For me, I can only speak for myself. I had 0 pain, no pain at all. And I'm not lying. I'm not over exaggerating. I literally had no pain. Now, I'm a person that has a high pain tolerance. However, with this surgery, I had no pain. I need no pain meds. I told the nurses, do not give me pain meds because I don't need it. I'm not in pain. And being a clinician myself of behavioral and mental health, and as well as an addiction and substance abuse clinician, primarily with opioid use disorder, I'm not about to be a patient myself. No. If I'm in pain, give me an ibuprofen, 800 milligrams. Don't give me no opiates, period. I don't play about no opiates. So I had 0 pain. So you will have 2 days in the hospital for recovery. That's for the majority of people if you have no complications. For me, I was in there for 4 days because I had complications. For some odd reason, I don't know if it was the anesthesia or what. I have no idea. But I could not hold any liquid or anything down, not even my own saliva. So which caused me to become malnourished, dehydrated, and I had to monthly, I had to get IV drips at the hospital to get my nourishment back because I could not hold anything down. And then I developed vertigo. I had fainting spells. Like, it was crazy. Like, at one point, I had this canopy bed and I fainted. I was in the home by myself and I hit my mouth on the poles of my canopy bed and woke up in between my ottomans. Like, it wasn't funny, but it's funny now. And then I had to go to the dentist to make sure my teeth wasn't going to come out because I hit my mouth. And it was acting like I was like in a domestic violence situation. I was like, sis, nobody hit me, okay? I fell. Like, I'm awkward and clumsy, and this is some random stuff that be happening to me, okay? But luckily, it doesn't happen to my teeth. I was fine. But I had fainting spells. I'm so dehydrated. I developed vertigo. But then, out the blue, 2 months later, it just went away by itself. Like, nothing happened. It was crazy. So, the advantages of bariatric surgery. What are the advantages? So, of course, it reduces your hunger. It gives you restricted portions. You won't overeat at one time because, baby girl, you don't want to do that. You do not want to do that. Less of a risk of malabsorption, no dumping syndrome, durable weight loss, and improvement or complete resolution of more than 40 weight-related diseases. So, fortunate for me, Fortunately for me, I had no medical issues. I didn't have diabetes, high blood pressure. Your girl was just chunky and like to eat, okay? I had no issues, but just being chunky, girl, okay? But for those who have medical issues like diabetes, take insulin, all that stuff, this weight loss surgery can help you reverse that. It can help you reverse 40 weight-related diseases. So if you take insulin, diabetes, high blood pressure, anything like that, sleep apnea, anything like that, look into bariatric surgery, you know? So what are the disadvantages? You can develop ulcers if you're a smoker. You can have stricture or narrowing of your sleeve. Less weight loss than gastric bypass on the average. Gastroesophageal reflux, which is acid reflux or heartburn. Possible gallbladder removal, malnourishment, and dehydration. So remember I told you I have malnourishment, dehydration, and I also suffer from acid reflux and heartburn, which Tums don't work. So I have to get my medication for acid reflux and heartburn prescribed by my doctor. So that's another factor, okay? And also, if you have weight loss surgery, they do tell you that it's a possibility that you will have to have your gallbladder removed, okay? Especially if you was having gallbladder problems beforehand, you possibly will have that gallbladder removed. Fortunately for me, it's been 7 years and I had no issues with my gallbladder, but I did develop IBS and acid reflux and heartburn. Is it debilitating? No. Is it causing issues in my life? No. Is it uncomfortable? Yeah, but it's not disrupting my life. Let's see. Recovery and diet after the vertical sleeve. So the VSG, the vertical sleeve bariatric surgery, obviously requires a lifelong lifestyle change. Like I said, this is not a quick fix or a miracle or magic dust. It's a tool to help you lose weight. Just like if you was on a diet, just like if you was on diet pills, it's a tool to help you lose weight. Shortly after you have your bariatric surgery, you will be reintroduced to foods in phases. So phase 1, while you're in the hospital after your surgery, you will be only able to do clear liquids. So that's like water, Gatorade, Powerade. Yeah, that's about it. That's the only thing you're going to do for the first 24 hours. If you could do that. And they monitor you in that hospital. Like, they want you to get all your liquids in that hospital. And while you're in the hospital recovering, every 30 minutes, you have to get up. Mandatory. You have to get up out your bed, out your room, and walk around so you can decrease the chances of getting blood clots. So that's mandatory, okay? And then, like a week later, you'll be introduced to full liquids, which means still like plain broth, Jello, water, Gatorade, anything clear, but like, full liquids. Nothing in the liquids. No like soup or anything like that. And then you'll be introduced to soft foods like eggs, puddings, stuff like that. And then you could go on to your regular diet. But they would tell you your main priority, even when you're in your clear liquid phase, is to be hydrated and to get your protein. Protein and hydration is the key to bariatric surgery for the rest of your life. Okay? And you have to get a certain amount of protein and a certain amount of liquids every day to be successful and to avoid medical issues for the rest of your life. Okay? So follow up. You will have follow-up visits 10 days after your surgery with your surgeon. Then 6 weeks, then 3 months, 6 months, and then annually, okay? And then you will also meet with your registered dietitian, and then you will also have support groups if you need the support. Okay? So, remember I told you that this is a big lifestyle change. Your diet would change drastically, and you have to stick to a diet for the rest of your life, as well as vitamins. So, you will have to take vitamins, multiple vitamins for the rest of your life. And if you don't, you will be sorry. No, for real, you'll be sorry. Learn from me, okay? So when I had my surgery, I didn't take no vitamins. They told me to take your vitamins because you are going to be malnourished, and because of your sleeve, you're not going to be able to intake the nutrition that you need on a daily basis, okay? I ain't listen. I could barely take Flintstone vitamins. And I already was anemic. I already suffered from anemia, but it was never that severe, okay? Girl. So here's my vitamins. So in here I have multivitamins. I have calcium with vitamin D, vitamin B12. So basically you have to take your multivitamin, and they do have bariatric vitamins. They will give you a link or paperwork to tell you what vitamins you should be taking, because you can't just take any of your vitamins, okay? Flintstone vitamins ain't gonna work for you, okay? They have bariatric vitamins, and if you can't get the bariatric vitamins because they are kind of pricey, then they will tell you exactly what vitamins to take that you could get from the drugstore or Walmart or anything like that, okay? So I take a multivitamin, I take a gummy, 2 gummies. Then I take calcium with vitamin D twice a day. And then they want you to take iron. But for me, because I was already anemic, and then after I had the surgery, I can't take iron pills because it would do nothing for me. It would be like a placebo. So I had to get iron infusions, okay? Then you have to take vitamin D. I take it twice a day. And then vitamin B12. Your vitamins is so serious. I kid you not. I thought they was joking. I was like, I ain't taking no vitamins. Girl, take them vitamins. I kid you not. Like shortly after the surgery, especially like 2 years after, I thought I was going crazy. I even scheduled an appointment with a neurosurgeon to get an MRI of my head because I thought I was bugging out. I thought that So I legit thought I was developing like adult dyslexia, because I started seeing words jumbled backwards, and then when I would read something, it would like look backwards on the paper, and then my memory was becoming poor. Like I couldn't remember nothing, couldn't get my words out, couldn't remember words correctly, and then it was just crazy. I was like, oh my God, like I need an MRI, and then it just dawned on me. And then actually when I went to the doctor's office, it was like, it didn't dawn into me till I moved to Maryland, actually. And I started the weight loss program again here in Maryland. And they was like, they gave me labs. And when you go to bariatric doctors to get weight loss surgery, they do different type of lab work. They check every single thing. Your vitamin levels, they check everything, okay? So the doctor told me, girl, you are chronically vitamin deficient. That's why you dyslexic and can't remember nothing, because you malnourished. So needless to say, I started taking my vitamins again, taking it seriously, like, because I thought I was going crazy. So your insurance, like I said, in Georgia I had Blue Cross Blue Shield. It only took me 3 months to be approved, and I got my surgery. In Maryland, I'm starting the process again because I am getting a revision. Okay, I'm getting weight loss surgery revision, and I'm gonna go into the revision process or why I'm getting a revision later on in another video. Okay, so insurance. Your insurance requires you a lot because, like I said in the beginning, this is not cosmetic surgery. You have to have a real reason as to why you need this, and for your insurance to pay 100%, and for your doctors to approve you. Like, without your doctors approving you, there's no, I'm gonna pay for it myself and get it done. No, you could pay for it yourself, but you still got to be approved by these doctors. The only way you'll need a doctor's approval or that paperwork is if you go out the country to Mexico, Dominican Republic, okay? Or Turkey, okay? But here in the United States, you got to be approved by multiple doctors before you get that surgery, okay? So your insurance is a 3 to 6 month process. Here in Maryland, I have Blue Cross Blue Shield again of Maryland, and they are paying 100% for my surgery, but it's a 6-month process. So it takes 6 months for me to get my surgery. I started in the end of March, and I will be done in October, and my surgery date is January 3rd for my revision. So I have to take 6 nutrition classes. Like I said, each doctor's office is different. Each doctor's office in Georgia, I only had to take 1 nutrition class. Here in Maryland, with my doctor, Dr. Kligman of University of Maryland, I have to take 6 nutritional classes once a month for 1 hour, and it's mandatory. They want you to fill out a food journal, and you have to take a picture of your weight with you standing on a scale with your weight. You have to submit that every month. Then you have to go to a psych evaluation. It has to be a licensed clinical counselor, a licensed social worker, a psychiatrist, or a psychologist. And they have strict documentation that they have to submit to your surgeon, and you have to meet with them in order to be approved. And they have to approve you. And they would give you an assessment. In Georgia, I did not have to do an assessment. I just had to meet with with a psychologist for 1 hour. Here in Maryland, they are strict up here, okay? I had to do literally like an exam. And the exam basically wanted to find out if you had an eating disorder. And then after I took that exam, it took me an hour. It was literally like an SAT. Then I met with my psychologist, and then we spoke for an hour. Then for me, I had to get a cardiologist. I had to find a cardiologist, which is a heart doctor, and get scans. I don't think that's the word, scan. I had to get my heart checked and everything to get approved. And they had to submit thorough documentation and approve me for weight loss surgery to my surgeon. Then you have to go to your primary care doctor. Your primary care doctor has to also give thorough information, specific information that your surgeon requests, and approve you for weight loss surgery. Then you have to, if you have sleep apnea, I don't have sleep apnea, but if you have sleep apnea, they will make you go to a sleep study. And then that doctor has to approve you and give the required documentation to your surgeon for you to get weight loss surgery. And then if you have heartburn or indigestion, acid reflux, then you will get an EGD. I believe it's an EGD. It's not an EKD. An EGD, where they put a scope down your throat and down to your intestines to see what's going on down there. And you will need anesthesia for that. And that is required as well. Like I said, I started this process at the end of March. So I got everything done within like a month's time, because due to my work schedule, I wanted to knock it out before anything happens and I have to get off early from work. No, I had all the time in the world to get all these done. So even though your insurance is paying for your surgery 100%, like I said, you have multiple doctors you have to go to before you could be officially approved by your insurance and your surgeon. So that's a lot of copays. So keep that in mind. So if your insurance requires you a high copay, put that money to the side, okay? Because you're going to be paying copays. So like I said, it's like a 3 to 6 month process depending on your insurance. You have multiple doctors to go to, so make sure you have the time from work to take off from that. I suggest that you get AFLAC or some type of insurance like that for short-term, long-term disability, just in case that your recovery period is longer than suspected, okay? Expected. Okay, so this is the first video on the weight loss journey. This is a vertical sleeve revision to a gastric bypass journey, okay? So this is the first edition. These weight loss bariatric videos will be put out every Friday at 5 o'clock, okay? Every Friday at 5 o'clock, and I'm gonna tell you more about my vertical sleeve journey. I'm gonna tell you more about the complications, dumping syndrome, what you should look forward to, what to expect. And if you have any questions, leave it in the comments. I will give you some suggestions on how to get approved by your insurance company, what to do. And then I'm going to do videos on my road to getting a revision to the gastric bypass, okay? And what I had to do, the foods I'll be eating, the stuff that I'm buying for it, how to prepare for it, and things like that. So if you like this video, if you like these type of videos and you are curious and you want this surgery or you have been thinking about this surgery, give this video a thumbs up. Don't forget to like, subscribe, and hit that notification bell. And look for these videos on Friday and as well as my other videos on Mondays and Wednesdays at 5 o'clock. All right? So, deuces. Well.